In this video, I am going to discuss the importance of coping skills during pregnancy and labor and delivery. This is important for conscious pregnancy and birth. More information on this can be found in my book, Mystical Motherhood, which is a guidebook for conscious conception, pregnancy, birth, and beyond, and can be found on Amazon. I can tell you personally that coping skills during labor and delivery are vital because I worked as a labor and delivery nurse for many, many years, and I met all kinds of patients. I worked with women who had clearly worked out their fears before delivery and those who did not. And there was a big difference in the way that they approached their birth and their labor and the outcome afterwards and how good they felt. And also just how comfortable they were handling the new stresses that motherhood can bring, no matter if you've had a baby or this is your third. A woman's attitude and approach towards pregnancy and life in general tends to manifest during childbirth and the immediate time before. Women go through labor in a similar manner to the way they live. And because childbirth can be a hyped up and emotional time, behaviors are often magnified. Coping skills are vital to have, especially when preparing for birth and motherhood. When the average woman enters the delivery room, they have absolutely no idea the extent of pain or discomfort they are going to feel because every birth is different. Pain is a strange human experience, and perceptions between people and cultures vary a great deal. Reactions to pain are also different, and they are influenced by the various ways that people deal with their stress or their fear. And I can tell you as a nurse, if you have any issues around control or you're a very super type A personality, you may have a hard time in a hospital birth if you don't prepare yourself ahead of time by touring the hospital or looking deep inside of your own personal issues. If you have a history with physical or sexual abuse, you need to seek help to heal this before your childbirth so that these fears don't arise during the experience. I provide so much more information on this in my book, Mystical Motherhood, and online at mysticalmotherhood.com. Here, I'm just going to give you some questions that you need to go over before you have a baby in order to prepare for a healthy birth. But in my book, you can find more writing exercises, prompts, and meditations that help you to get to know yourself and also prepare for you to approach motherhood consciously. In this video, I'm going to go over some of the qualities that lead to a low risk childbirth. If you have issues in any of these areas, please tend to them before you have your baby, preferably even before you conceive your baby. Here are some questions I want you to begin to ask yourself. Do you consider yourself an active and independent woman? Do you like to take charge or sit back and watch others? Can you find a balance here? Can you find a neutrality in yourself? Are you able to take support from others? If someone tries to help you, how do you react? Are you able to deal with changes in an appropriate manner, or do you tend to resist? What are you scared of? Have you worked through these fears? Do you think of yourself as sexual? Do you have a healthy attitude towards sex? Do you approach sexuality with your partner in a comfortable and relaxed way? Are you clear and honest with your communication? Do you tend to lie to yourself or do you tend to lie to anybody else? Do your spiritual beliefs match your ideal pregnancy and birth? Or are you giving birth in a place that you're comfortable with and with a partner that you're comfortable with? Have you ever been physically or sexually abused? And if so, have you dealt with these issues? Do you consider yourself powerless? Do you and your partner have a loving relationship? Do you trust your partner? Do you have a history of not trusting people in the past? And does your partner ever speak to you in a negative way? Does your partner usually speak to you in a positive way? How will this come up? How will these issues arise when you actually have a baby? All of these questions you can scan back through and you can begin to journal about. They're really, really important before you have your baby actually come out, but also specifically before your labor, because they'll help you predict of whether or not you're ready to give labor in a more mental way. More of this can be found at mysticalmotherhood.com. And also, if you'd like to subscribe to this, you can find out more. I'm here to teach you all about conscious motherhood, birth, pregnancy, and beyond.